Hi, my name is Elizabeth Edwards, and I'm a licensed marriage and family therapist at Foundations Family Therapy. Um, I've written an article today on perinatal mental health, and basically, kind of what that means is women who are pregnant or have had a baby within the last year. So that's kind of mostly what I work with. So that encompasses postpartum mood disorders such as depression, anxiety, psychosis, OCD, bipolar. There could be a host of things that happen in the postpartum period. And typically, what we see is those things start in the third trimester. So I also work with pregnant women who are experiencing the same type things. So that's mostly what I see. And then I also work with infant loss and abortion recovery. So that includes miscarriages, infertility, and then abortion recovery, like I mentioned. So right now, what we're kind of seeing across the board since COVID, really, especially, is great increases in anxiety and depression across the board. So from our children to adults. And with that, we're seeing really high rates of depression because of the isolation factors with COVID and suicidality and things like that. So we're really seeing some pretty serious things. So, for this article, I just kind of wanted to give a few specified pointers just for the population that I most work with, which is that woman that's in childbearing age. So again, pregnant or new mom or things like that. So one of the things to kind of remember is that you have to kind of take care of yourself before you can totally commit fully to taking care of your new baby. So a lot of times what we see in perinatal mood disorders, the number one symptom that I see or that's across the board is an inability to sleep when you have the opportunity. So if you have a chunk of time that you can sleep and the baby's cared for, but you're unable to sleep, that's usually a pretty good indicator. And then along with that, oftentimes shows up as anger. Obviously, anxiety such as ruminating thoughts, not being able to sleep because you're watching the baby constantly to make sure that it doesn't roll over and suffocate or whatever it is. So all these things, it's kind of like an amplified normal response, but really, if you're not sleeping, if you're having these ruminating thoughts, that's kind of going to be an indication that maybe things aren't quite where they should be. So we definitely want to focus on getting your needs met first. So making sure that you do have those chunks of time where you can sleep, that you can ask for help where needed. And I know that could look different with COVID, but even from your support person or your partner, just asking for help to get you some sleep, make sure you're eating well, drinking water, the basics, things like that to help your mood. Because if those things are off, you're kind of setting yourself up to fail. So the next kind of thing that we can focus on is our thinking. So with that, kind of the most basic skill is to kind of identify some common thoughts that you're having. So whether they be anxious thoughts or depressive thoughts, and kind of learn when they occur the most, but also learning what they are. So usually there's themes around them, whether it's you're not good enough or you're a terrible mom or whatever it is. So if you can identify some of those thoughts and kind of when they're most likely to happen, then you can start to kind of challenge those. So some of the questions we use to challenge our thinking is it true all the time? Or did this just happen a one-off type thing, or did I make one mistake, but normally I don't, or things like that. So finding the exceptions to the rule in your brain. Is it, asking yourself, is it true that I always must fill in the blank? And then thinking through like what your support person or your friend or your therapist or somebody, what they would say. So if they heard kind of what you were thinking, what would their response be? So normally we give other people way more grace than we give ourselves. And so in our mind, we kind of hold ourselves to really high standards that we don't really hold other people to. So it could be that you are kind of setting yourself up to fail in that you have these really high standards for you or you and your child. And it's not anything that you would hold anyone else to. So trying to think through, like, what would someone say? Is this always true? And then a third question is just kind of, is this going to matter in the big picture? So, a lot of times we worry about things that in the long run, at the end of the day, in 10 years, even next week, aren't going to matter. So trying to kind of identify, am I spending a lot of time on things that don't matter ultimately? So trying to just kind of identify those, and then once you do, you can kind of change them. So I often talk about the control circles, where you kind of think about everything that you're worried about or that's on your mind, and you draw 2 circles. And on the inside circle, you write things that you're worried about that you do have control over, so you can control it. And then on the outside, you write everything that you're worried about or that's on your mind that you have no control over. So usually that's where most things fall. And so then, you're going to kind of realize that you don't really want to waste your energy on things that you have no control over, and to try to figure out, what's something on the inside circle that I can work on or control. So kind of trying to challenge those thinking, and then try to move through, is this even within my control? And a lot of times as parents, it's not. So spoiler alert. So those are just some tips. If you choose to engage in therapy, it doesn't mean that you have some major perinatal mood disorder, or it could just be stress or transition. We see a lot of that. So please know that the journey is individual to you, and we're here for you and to help as best we can.